Mr. Eager, thank you so much for joining me for an in-person interview. We're seated far apart. This is the first in-person interview since COVID, so it's great to have you here.
Good morning, Jacqueline.
So we've heard for years and years now, over and over, we are one economic downturn away from KRS being bankrupt. So we are now facing an economic downturn as a result of the coronavirus. So what does that mean for the Kentucky retirement system?
It means we're not going to go bankrupt, I'll tell you that, for
Okay.
sure, absolutely. And I'll tell you why I said that, because beginning in fiscal 2019, our funding for all of the plans, particularly K-9 has, which is the most underfunded, increased substantially. So we're getting cash flow, and K-9 has, we're cash flow positive. That means we're getting more in contributions and we're paying on benefits. It's not going, the level's not going down. And to the extent we have assets, and I'll talk about the current situation in a bit, I'm sure you want to know, but
Yes, absolutely.
we've been averaging 5 to 6% returns over the last 20 years, so that adds to it. So we're getting positive cash flow from the state, and we're getting positive increase in assets. It's just, the way I describe it is the train is on the track, and it's going to take 30 years for it to reach its destination, but we're clearly moving ahead, solidly ahead.
And part of the coronavirus things that we're talking about is the market. And so obviously we know that increased contributions have happened over the last couple of years, but we're facing some, disruptions in the market. So what does that mean for KRS? How are your investment returns doing?
Okay. Through, well, let me back up a little bit. At December 31st, they were up, the funds were up 5 to 6%. March 31st, they were down 5 to 7%. April 30th, we're down 1 to 2%, and we're ahead of those numbers. So we'll probably finish, in spite of what's happening, in 1,500 point down days and 600 point up days, and it gets again today now, 600 points. We'll probably finish positive in all of the funds, just slightly positive.
That's good. So,
That's good. It doesn't meet the actuarial assumptions,
okay.
which is bad. But to come through this period of time with the market volatility and the negative returns experienced by funds all over the country, we're in excellent shape, relatively speaking.
So back in April, the Tax Foundation released something about the funded status of pension systems across the country. They were 2017 numbers, and the study noted that because of increased contributions, each of them was slightly improving. But they named Kentucky the worst, followed by New Jersey, and then Illinois. So, and it was, I believe we were at 34% funded, and that was for both plans. So, but what's the current funded status of KRS?
About the same.
Okay.
It might be down slightly. We asked GRS to do some, GRS is our actuary. We asked GRS in late May to do some projections and said, all right, let's take the assets as of today, May 26th. Let's assume they don't earn anything, go to June 30th. And then tell us what the change in the funded status and contribution rates are going to be. And essentially, if you look at the K-9 has, which gets the most focus, the funded status was essentially 14% last June 30th, be 14% again. So there's been no decrease in the funded status of K-9 has. There's a slight decrease over the next 5 years in the C-9 has, but about 2.5%. The impact will be at negative 2.5%. It'll still be 55% funded, but it'll be 2.5% less than it would have been had we not gone through this period.
And the fact that we aren't seeing a decrease is a good sign, because we knew that we would see a decrease before we went back up, especially after the reforms we made to the system a couple of years ago. So for people who don't understand, kind of what's going on with the pension system, we hear that we're 14% funded, and that doesn't sound very good, but we are slightly improving according to you guys, right?
Well, this year will be flat, but it's improving, and it'll improve it over the next 30 years. It'll be 100% if we get the funding we want, we earn the returns that we want, we have the payroll growth that we expect. So it's like a 30-year mortgage.
Speaking of the money you need, let's talk about the legislature and the one-year budget they just passed. They were planning on doing a 2-year budget like they always do, and then the coronavirus pandemic hit. So they ended up cutting a lot of different areas where they planned to invest. But what did it look like for KRS? Did you guys get the money you needed? And next year, are you going to need to ask for more money based on what's happening right now?
Yeah, I think that, in a way the answer is yes. We would have wanted more. We recognize the situation. We recognize budgets are tough. We had two things happen. Number one is I refer to the 30-year kind of a mortgage, if you will. It's not a mortgage, 30-year payoff of the unfunded liability. It's in what's called a closed period, so each year it gets paying down just like a mortgage would pay down a mortgage. We set a closed period of at 30 years 6 years ago. We were down to 24 years. And the legislature reset it to 30 years. So what does that mean for KRS? It means we get about $235 million less than we would have gotten. So it's like refinancing a house. You extend the period, your mortgage payment goes down. We're going to get the $235 million. We're going to get it eventually. We'll get the same amount of money. We're not deprived of any money. It's just going to take longer to get it. So that's one area. They extended the freeze on the quasi rate at 49%. That's another $100 million or so that we're getting shorted, and it'll be made up eventually in higher contribution rates. And they also froze the C system rates. C non-HAZ is 24%. It was scheduled to go up by 12 to say 26 and change. They froze it at 24%. So we got less money than we would have gotten had they not made the changes. We understand the situation. We're going to get the money in the end. It's just simply it's being delayed.
And that's a good point about the quasi-governmental agencies, the freeze again. These are things like health departments and things that have been critically important during the coronavirus pandemic, so, and they're continuing to struggle. When do you think they're gonna have to let up on the freeze? Do you think they're gonna have to do it again next year? What does the future look like for these agencies?
Well, the agencies were being offered 4 options to get out of the system. 2 required installment payments over a period of time, and 2 required a lump sum payment. That was scheduled to take effect this April, and it's been delayed for a year. We'll see. Of 115 agencies, about half of them applied to at least see an analysis of what it would cost them to get out. Whether they would do it or not is another question. But the ones who didn't apply apparently are going to be able to make the payments that are going to be required.
And if they do get out, what does that look like for KRS? Obviously, they're going to have to pay off their liability, but it's going to take a long time. So what does that look like for you all?
The rates that are being set are actuarially sound, so it's not a penalty to us. In fact, the discount rates that we're going to use to set the liability payoff are lower than the current assumed rates. So it really means we're getting a bit more in payout than the actual liability.
So let's talk about a different kind of hit to the system, and that's retirements. We hear a lot about people wanting to retire because they're wary about what's happening with the pension systems, especially with KTRS. We hear it a lot, but we do hear it with KRS as well. In light of the coronavirus pandemic and just everything going on, have you seen an increase in retirements in KRS?
Actually, a decrease. We know what 2020 will be because we already had the June numbers. They're down about 12% from the year earlier. So in rough numbers, they're 6,000 plus and down from 7,000 plus. We've asked the actuaries to comment what the actuarial impact would be of that, and they essentially it's very nominal. No much effect one way or another.
Why do you think the retirements are down?
Well, fewer people.
True.
The system has fewer and fewer people. We've gone from 46,000 10 years ago to 33,000 in the K9 has. So the percentage of workers may be the same or may be up a little bit, but there's fewer people in the system. I think it's in times of uncertainty, people also decide they'd rather keep their job than retire. And it's certainly a time of uncertainty.
So obviously the coronavirus has had a big impact on all kinds of businesses, on organizations. Here at the Kentucky Chamber, most of us are working from home. When we are here, it's at a very lowered capacity. It's uncertain, and we wear masks, and I took your temperature on the way in here. So what does it look like for KRS, and what do you...
Second time today.
Yeah, exactly. Which is kind of our new reality, you know? So, but what does the future of KRS look like? Are you going to make any changes, and how has the coronavirus impacted you as an organization? Yeah,
very interesting. I'll step back. We had people from time to time in the past say, I'd like to work from home, and the answer was, we're all working in our 2 buildings here. So we are forced into this. But I can't recall the exact dates, but middle of March to late March, we had 50% of the people. And we have 257 people working here. better than 50% were working at home. Right now it's 85 to 90. And we're finding out it's not as painful as you would have thought. It wasn't easy. I remember on March the 9th saying, buy as many laptops as you can, because we're going to have a lot of people working from home. There's going to be a scarcity, and there was a scarcity. It took a while to fulfill our needs, but efficiency seems to be as good as it was when we were working. We have people who like it a lot. We have people who don't like it. And we're in the process right now of determining who really needs to be working there. And there are some right now that need to be, and they are there. And they're, wearing masks and doing all the things. But of the remainder of that 85 or 90%, we're trying to determine, are there some of those that we still need back in the office? And of those that aren't, we're going to be asking their preferences. Do they want to be 100% at the office in Frankfurt? Do they want to be 100% at home? Or do they want some kind of a blend? And so there are all kinds of ramifications about this. So if somebody's coming in 2 days a week, do they really need an office to themselves or a cubicle to themselves? Probably not. We're going to have some shared office space or cubicles. I think the other thing I comment on is we have a good number of people who work in cubicles, and a lot of them are fairly small. And you can almost literally touch the walls. And when they leave the cubicle, there's no way they're 6 feet from the person in the next cubicle. So we're going to be examining just how we put people in spaces and offices and cubicles and so forth. But it's here to stay. I'll tell you, I was on a Zoom call Friday with about 25 other executive directors, public fund, state fund directors, for an hour. New York State, CalSTRS, Colorado, just all over the country. And I was really somewhat surprised by the sense that, and their outlook, that they're not coming back anytime soon. The idea that we got 85, 90% working at home, pretty much uniform. They've got buildings that are empty. CalSTRS has 1,500 people on 7 floors, and he said, we don't need this space when we come back. So for most people, it looked like nothing before 2021. That's kind of the consensus. One agency said not till there's a vaccine, however long that takes. So the new model is you can do it with technology, you can do it from home. I think it's satisfying employees more. If you want A, you get A to the extent we can. If you want B, you get B to the extent we can. There's 2 issues that have come up that's been written about, and I totally agree. Corporate culture. How do you maintain the culture when people aren't getting together, aren't having department meetings? As you know, Zoom isn't the same.
It's not.
And the term Zoom fatigue is coming up.
Yes.
I had 2 Zoom meetings this afternoon, so I'll be fatigued by the end of the day. You can't read expressions as well. You're dealing with technical issues, Jacqueline, you're on mute, we can't hear you. That's one of the most common things we hear. It's just not the same, but at the same time, we're doing our board and committee meetings. We've been live streaming it since 2017, and we're doing the board and committee meetings Zoom. And I think it's a good thing. And I initially thought we were prohibited from, once the executive order was lifted and we had to come back to work, I thought we were prohibited from doing Zoom conferences for our trustee and committee meetings. And the answer is no, we aren't. We just have to allow people to come into our offices, once we're open, come to the office and sit and be able to see on a screen all the directors that are there and that are talking. So I think there's a lot of advantages. We had, for a number of years, we had a director from Fulton County. And I had to look at the map to see where Fulton County was. It's about as far away as you can get.
Yes, it's not close.
I mean, it's this furthest southwest in the state, and it took 4.5 hours for this person to come. So it was an inconvenience, number one. But it also didn't allow us to have special meetings on short notice. And by that, I think there may be issues that come up that could take 5 minutes to resolve, but it takes a board resolution to do it, or a board vote to do it. and you call a board in for 5-minute meeting, probably not, you delay. But on Zoom, you could have a 5-minute meeting, 24 hours notice, a special meeting, get it done and take care of it. So, I mean, the market started going down in February, and we didn't have a board meeting until April the 21st, I think. I mean, it took that long to kind of advise them what was going on. So I'm hopeful that we're really going to run more efficiently, be in touch with our trustees more regularly. So it's just that had a silver lining, and it's going to be really quite beneficial for us.
Absolutely. So now, is there anything that we haven't covered today that you want people to know about, especially about the funded status or where KRS is at? You know, there are always a lot of questions publicly about the pension systems and where we're at and how expensive it is for the state, especially now that our budget is getting tighter and tighter.
Yeah.
So is there anything you want people to know that we haven't covered?
No, you haven't asked about House Bill 484, which is just kind of on the table for people. 484 is a CERS separation bill. As executive director, I lobbied not to have it pass. I'm allowed to comment on administrative and fiscal issues. I don't set policy, the board sets the policy, but from an administrative standpoint, it's problematic. It's separating those two systems is going to take a lot of time and money. It's not as efficient as having the systems together. So the good thing that came out of our discussions with the proponents of 484 was that rather than totally separate these systems and have a complete staff in the seats and complete staff in Kansas State Police, the body of employees that work at KRS are going to stay together. And it's going to be now called the KPAA, Kentucky Public KPPA, Kentucky Public Pension Authority. So rather than create two benefits groups right down the line from everything the benefits people do, with 2 legal staffs and 2 audit staffs and so forth and so on, 2 accounting staffs. That's going to stay together as a right. That was a smart thing to do. But there'll be a KPPA board, 9 people. There'll be 8 people, there'll be a K and State Police Board, 9 people. There'll be a C board, 9 people. So we'll have 3 board meetings every 4 months, or every 3 months, rather than a 1 board meeting. And we'll have 2 healthcare committees, 2 investment committees. We may have 2 audit committees. And so it's just the complexity of running it. And we're accountable to each of those. So it passed, and it passed by a very strong majority. I was surprised how much supported that.
You talked about the fact that it's going to cost money. You have an anticipated cost of kind of separating it out?
Well, we originally estimated somewhere between $3 and $7 million a year. And there's also a startup cost that's more nominal. But we're spending a lot of time, staff's spending a lot of time. I have one of my Zooms this afternoon is House Bill 484. We had, at one point, we've got a list of the tasks and the questions. Like, do we need to get private letter rulings from the IRS on certain things? That's like one question. Mm-hmm. We have 88 tasks or questions right now, and that list keeps growing. The bill doesn't take effect until April 1 of 2021. So on April 1st, 2021, these 2 systems are operating. They won't even have boards. They won't have an executive director because they have no authority on March 31st to do that because they're not a body yet. So we're suggesting they really need to set those boards and committees up early in the session, or as fast as you can in January, and get them operating so on April 1 they've got their feet on the ground. So, and the other thing I'd point out is that we came up with what was a solution for what we call the contribution death spiral. You and I have talked about this in the past. Yes. Contribution rates keep going up. They're for K-non-HIS, they're 84%. In other words, if you hire a person and pay them $50,000, you have to pay us 84% of $50,000 every year. And what that's led to is, what do you do as an employer to minimize the impact of that. You outsource people, you don't replace people, you don't replace retirees, you shrink your workforce. And we have one agency, for example, that 10 years ago had over 300 employees, and today they have 3. There's still 300 people that come to that building. 297 of them just don't work for the agency. They happen to work for a nonprofit corporation that this agency set up, so they're not required to make contribution to the pension fund. So, you know, in a way, I don't blame them. You know,
Right.
Universities are outsourcing food service and maintenance, and I said we went from 46,000 to 33,000. We're going to keep going down. And every time there's fewer and fewer employees, it doesn't mean the aggregate payment of what KRS needs to get goes down. It stays the same.
Your liability still exists.
Liability still exists, so the people who remain in the system have to pay more money. And and that's what they call the death spiral. We had a way out of that problem, and it was House Bill 171, which said, all right, we're going to take what each agency has as a liability, what they effectively owe the system to make it whole, and that's going to become a debt that you pay off over 30 years, or there's a variety of ways you can come at the funding of that. But essentially, you lay off some more people, you outsource some more people, you still pay us the money. That's the money you owe us. And in the House, it passed 90 to nothing.
Wow.
It didn't get a hearing in the Senate, unfortunately. And one of the problems was, in aggregate, when you sorted out all these liabilities and assigned them all these to 300 and some agencies, including the state, some employers' rates go down, and they go from 84 to 40,
Right.
and some go from up, and they go from 84 to 150. But the aggregate of all these agencies is, based on last year's data, would go down $34 million. So the state would have to make up the other $34 million. The state's share and the state contribution rate would go up about 3%. It's $34 million. And when we're looking at, and I don't know that this is directly, nobody has said this directly, but when you're going through a one-year budget and you're anticipating big revenue shortfalls, it's understandable for them to say, hey, we can't afford to do that.
Right.
I understand that. Ultimately, we've got to figure out a way to do it.
So do you anticipate bringing this back up in 2021? Because they're gonna have to do the second half of the budget and they're gonna have to redistrict. 2021 is gonna be a big,
Yeah.
tough year for them.
I'll do some talking to key legislators, but I don't think they'll have the appetite because of what's going on. I think there's an acknowledgement that this is a solution, but the timing is just bad.
Are there any other changes that you think need to be made to KRS in the near future to help the system?
No, I don't think so. I think Senate Bill 2 was, in 2013, was key. It said, whatever the actuary says is what you got to pay. You got to make that contribution. So that was a lifesaver for us, because we went years where we were getting about 40% of what we're supposed to get. 14 years in a row, we're getting 40% of what we're supposed to get. So the Senate Bill 2 was a lifesaver. The other thing that happened was we reset economic assumptions in 2017 to more realistic, more conservative. It resulted in more conservative investment allocations, and that is a big saver in this downturn. We saved a lot of money in that, and PPOB members were saying, you know, we were critical of you getting too conservative. Now we're happy that you did.
Right.
I mean, that's comments that came with it, and we appreciate that. The assumptions. So the conservative assumptions, investment return, payroll growth, or in the case of K9, has no growth.
0.
When those were reset, the liability went up $5 billion. And the headline in the newspaper was, KRS loses $5 million. We didn't lose $5 million. We just said, realistically, it's going to take $5 billion more to pay off what we owe to the retirees. It's simply saying we were too optimistic that the investment returns were going to be able to, future contributions were going to be. Then we, this past year, looked at retirements, and we extended the estimate of retirements by about 2 years. And for current retirement, for anybody who's younger, it was going further. So if we said a 65-year-old male male will live till 84, we're gonna say, well, wait a minute, 40-year male's gonna live to 86. Those two things, $2 billion. So in the last 3+ years, we've added $7 billion to what we think we are ultimately going to pay, and that's really hurt the funded status.
But the more realistic you are in your, because we were not being realistic for many years, and that's part of the reason that we got to where we are,
Yeah.
which is why legislators have, I think, appreciated.
Yeah,
the mix of this.
and I think you asked me, the first time we did an interview in 2017, what was I surprised at? And I think one of the things was, and I may have said the same exact thing, but you think about what a senator or a representative would say, what do they have to know? Education, transportation, recreation,
Everything, infrastructure, budgets, everything.
I mean, there's a tremendous amount of detail on each of those, and they're expected to know. And there weren't very many people who understood pensions, and there weren't very many people who understood that you got to pay the piper at some point.
Right.
And you may have a need to do something to the highways immediately because the bridges are in bad shape or whatever. But to the extent you deny the pension fund, you will ultimately have to pay the piper, and that's where we are right now. So, but I think my sense is the legislators are, even in the 3.5 years I've been there, extremely better educated. And many of them, not all, but many of them are. They're really working hard to solve our problem, and they're doing it in a bipartisan fashion, and I think that's great.
I think that's a perfect place for us to end, so I want to thank you so much for coming to sit down with me. I always enjoy talking to you, and I'm sure we'll catch up again soon.
Okay, thanks, Jacqueline.